Okay, hello and welcome to the observation bay. I'm Gemma, I'm the doctor in the observation bay. The purpose of the obs bay is to look after patients who perhaps need a little bit more input than their 4 hours necessarily allows. So especially older people with dementia who come in with falls and need a bit of a workup or a night of observation or unable to be discharged late at night. Especially if they need any kind of therapy input, so from our occupational therapy and physiotherapy teams, they can come here and have further specialist input in A&E and not be admitted to hospital. So the obs bay is a really useful place to try and avoid admissions to hospital by doing more of the work down here that the therapy team can do, and often you will, if you're working here, you will do a ward round in the morning with a consultant, and that will mean that you then have an idea about what's going on in the bay, and then people come here throughout the day. So if you're bringing a patient over here in the daytime, there's a few important things to remember. You've got to think about why they come into the obs bay. So it's not a place for medically unstable patients. It should be for fairly well patients who just need a few bits and pieces sorted out either medically or therapy wise. So we really shouldn't have anyone snoozing highly in here. We often find that patients have very quick turnarounds in here, and that should be the goal, that it shouldn't be patients who actually need to come into hospital for a prolonged stay. If you bring a patient over here, it's your job as the doctor bringing them over to do the drug chart for them. So we have different drug charts in obs bay, so they're big pink drug charts that you need to fill out, and you should hand over the patient to the doctor in the obs bay so that at least they know what's going on with the patient that you bring over, because there's a heavy turnaround throughout the day, so it can be quite confusing to see where all the patients are. Other than that, what else do we do in here? It's a bit different in here from the rest of the. It's not a regular hospital ward, and it's not regular A&E. So some hospital teams won't come down here as they normally would on the ward, so you've got to think carefully about what they need. So if they need certain specialist services, they can't come in here, they do need to be admitted under one of the medical teams. So for example, the pain team don't come down here and the TVN doesn't come down here. So if they are coming in for a reason to see those people, they really should be referred to one of the teams. Other than that, this place tends to be filled with older patients. We don't often have very young patients in here because they could be discharged or moved on quickly. So this is a really useful place, but just remember to hand over everyone to the doctor and make sure that the therapy team know about them and they're not just dropped in here with the expectation that they will be seen. Great. Yeah, and that is the observation bay.